Okay, good afternoon, students. Mm, Trishna, are you ready?
Yes, ma'am.
Okay, so turn on your video. What is your topic?
Ma'am, urine collection method.
Okay. So you can start now. Okay, are you ready? Ready, Trishna?
Yes, ma'am.
Okay, so you start. Turn on your video and you can start. Do you want to share screen?
Yes, ma'am.
Acha, wait 1 minute. Okay, try Krasun.
Ma'am. Okay, ma'am.
Okay, so please turn on your video and you can start now.
My screen is visible.
Yes, it's visible.
Okay. Okay.
প্রথমে you
Good afternoon.
you minimize it, minimize করা, you just introduce yourself, introduce the topic, তাৰ পিছতে you show the screenshots. First introduce yourself.
Okay, ma'am. Good afternoon, my dear respected teacher and my friends. My name is Trishna Rajbangshi, DDRT second sem student, and today my presentation is urine collection method. Ma'am, can I share my screen?
Yes.
My screen is visible, ma'am.
Yes, it's visible. You
My
can start.
Okay. Urine collection method. Definition of urine collection method. The urine sample collection is a procedure used to obtain a sample of urine from a patient. The sample is used for diagnostic test. Methods. Diagnosis requires collection of urine generally by one of four methods. First, sterile urine bag to ureteral catheterization, CATH. 3. Uh, suprapubic aspiration, SPA, and 4. clean cats. 1. Sterile urine bag. Bag urine over the genitalia and waiting for the child to void into it. Although this method is non-invasive and is often to clinicians' choice, it has the highest rate of contamination up to 50%, commonly with Peri-Uretal Flora 20 to 25. 2. Ureteral catheterization, CATH. Ureteral catheterization is a routine medical procedure that facilitates direct drainage of the urinary bladder. It may be used for diagnostic purpose to help determine the etiology of various genitourinary conditions, or therapy utically the relief urinary retention, instill medication, or provide medications. And 3. Suprapubic aspiration, SPA. Suprapubic aspiration is a procedure to take a urine sample. It involves putting a needle through the skin just above the pubic bone into the bladder. It is typically used as a method to collect urine in child less than 2 years of age who is not a toilet trained in an effort to drainage a urinary tract infections. And 4. Clean cats. A clean catch is a method of collecting a urine sample from the state The clean catch urine method is used to prevent germs from the penis or vagina from getting into a urine sample. And last one, purpose of urine collection: to observe urine color and clarity, to determine the acidity or alkalinity of urine, to determine the presence of glucose, albumin, cation bodies in urine, to aid in diagnosis of renal disorder, example acute renal failure and chronic renal failure, etc., to measure urine specific gravity. Thank you. Ma'am?
Yes, finish.
Yes, ma'am.
Okay. See, some of your friends have joined now, or maybe they were having network issues. So do one thing from the beginning. You explain once again.
Okay,
একবার
ma'am.
explain করা, no?
Okay. Definition of urine collection method. The urine sample collection is a procedure used to obtain a sample to urine from the patient. The sample is used for diagnostic test methods. Diagnosis requires collection of urine generally by one of four methods. 1. Sterile urine bag. 2. Urethral catheterization, CATH. And 3. Suprapubic aspiration, SPA. And number 4, clean cats. Sterile urine bag. Bag urine collection involves wrapping a sterile plastic collection bag over the genitalia and waiting for the child to void into it. Also, its method is non-invasive and is often the clinician's kindest choice. It has the highest rate of contamination up to 50%, commonly with Peri-Uretal Flora 20 to 25. Urethral catheterization, CATH. Urethral catheterization is a routine medical procedure that facilitates direct drainage of the urinary bladder. It may be used for diagnostic purpose to help determine the etiology of various genitourinary conditions, or therapeutically to relieve urinary retention, instill medication, or provide irrigation. Number 3, suprapubic aspiration, SPA. Suprapubic aspiration is a procedure to take a urine sample. It involves putting a needle through the skin just above the pubic bone into the bladder. It is topically used as a method to collect urine in situations where tract infection. And number 4, clean catch. A clean catch is a method of collecting a urine sample to be tested. The clean catch urine method is used to prevent germs from the penis or vagina from getting into a urine sample. And last one, purpose of urine collection: to absorb urine color and clarity, to determine the acidity or alkalinity of urine, to determine the presence of glucose, albumin, and cation bodies in urine, to aid in diagnosis of renal disorder, example acute renal failure, chronic renal failure, etc. And the last, to measure urine specific gravity. Thank you.
Okay, you ask the group if they have any doubt.
Okay.
তোমার ভিডিওটা অন করা, and you please turn off your screen share and you on your video. Turn on your video. Okay, ask your friends if they have any doubt.
Anyone any doubt?
Krishna,
Yes.
what is peri-uretal flora?
What?
What is
Urethral-
peri-uretal flora?
Sorry, I cannot explain. I know, but
You can say in Hindi also, English
Say,
language you are
Krishna,
comfortable.
you say you should be prepared when you come for seminar. You can speak in anything. They will understand.
मैम मैं स्क्रीन टू मैम मैं स्क्रीन शेयर कर सकती हूँ फिर से
हाँ करो.
One, um, 1 minute.
Try now.
Okay. Sorry. Srijana? Hello? 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 Hello?
Yes, Trishna.
Hello?
Yes, Trishna.
Yes, हाँ तुम्हारा क्वेश्चन हेलो
Peri-Uretal Flora.
थोड़ा सॉरी सृजना तुम्हारा मतलब मुझे कुछ सुनाई नहीं दे रहा है
What is peri-urethral flora?
Peri-Uretal Flora.
लास्ट लाइन में देखो तो स्टेराइल यूरिन बैग का नीचे
Gosh.
नहीं स्टेराइल यूरिन बैग commonly with peri-urethral flora है ना जो
Yes. Peri
What happened, Trishna? Do you know the answer or not?
Ma'am,
Yes.
the most frequent potentially uretogenic bacteria.
What?
Most frequent potentially uretogenic bacteria.
Okay, and you have to explain some more, na?
Yes. And Peri-Uretal region, these were found approximately twice, and frequency is an urologically normal persons. मैम इतना भी आइडिया नहीं है मैम.
Okay, this what was the question? Peri-Uretal Flora, right?
Yes ma'am.
So this Peri-Uretal Flora is what? It is a flora, okay? It is a natural flora and it is present in all, male also, female also, okay? And it is present in the pubic area for females, okay? And for male also it is present in one of the tract, urinary tract, okay? Of both male and female. Okay, natural flora means what? It is present, natural flora means bacterias. Okay, some bacterias are there, some healthy bacterias which protect you. Okay, which colonize and also protect against different types of organisms or sicknesses or infection. Okay, and this flora is, some floras are not healthy, but this flora, this natural flora is present and also it is healthy. It is a healthy one which will protect you against different kinds of infection, viruses, okay? So that is known as the urethral, peri-urethral flora that is present in your, for female, it is present in the pubic area, okay? And sometimes what happens, this vaginal flora which is present, it sometimes it will change, okay? It changes with age also, sometimes with the age of the individual. Okay, and then sometimes because of the pH level, sometimes because of hormonal changes, okay? But this is present in both male and female. And it is a healthy one. Okay, Srijana?
Okay, ma'am. Thank you, ma'am.
Mm. Okay, continue, Trishna.
मैम मैम अभी फिर से स्क्रीन शेयर
ना
करना
लगे,
पड़ेगा.
no, no, नहीं चाहिए. You ask if they have doubt, any more doubts. If no doubt, then you ask any 10 participants questions.
Okay ma'am. Anyone doubt?
And turn on your video, Trishna. No doubt.
Anyone doubt? Okay.
No.
Okay. Deposit Chokia.
Yes.
Tell me definition of urine collection method.
The procedure is urine from a patient, or it used for diagnosis. Hello.
Please repeat again.
It's a procedure used to obtain a sample of urine from a patient, or it used for diagnostic test. मतलब ये एक प्रोसीड्योर है।
Okay, thank you. Next, Yatulika. Yatulika.
Absent.
Okay. Sital. Sital.
Yes.
Okay. What is sterile urine bag?
Don't know.
Okay. Srijana.
Yes.
What is sterile urine bag?
It is a procedure of taking samples into directly a sterile bag or container.
Okay, thank you. Second, Rasmi Sonal. Okay, tell me 4 methods of urine collection.
Urine bag, clean clear, pubic aspiration, SPA, ureteral catheterization, CATH.
Okay, thank you.
Thank you.
Okay, Vishal.
Yes.
Okay, purpose. 2 names of purpose of urine collection.
To measure urine specific gravity and to observe urine color and clarity.
Okay, thank you.
Thank you, Krishna.
Darshana.
Yes.
Okay. What is clean catch?
A collection a urine sample to be tested.
Okay. Okay, thank you. Ilasara.
Yes.
What is pubic aspiration?
This is a procedure to take a urine sample by putting a needle through the skin just above the pubic bone.
Thank you. Tumpe Jillan.
Yes.
Okay, to name of purpose of urine collection.
To observe urine color and clarity to determine the acidity of alkalinity of urine.
Okay, thank you.
Okay, done,
Ma'am.
Krishna? Okay.
Yes, ma'am.
Okay. So see, after collecting urine, okay, whenever you collect a urine, okay, it is very important for dialysis students. After collecting urine, most importantly, you should always write the name of the patient in the urine container so that it doesn't get mixed with other patients. Okay, it's very important to many of them, they forget to write the name. Okay, patient or naam to likhibo lage in the container, urine sample container. Okay, and then you should also write the date and time. Date means if today you have collected the urine, then today's date and also time. If you collected at 1:30, then 1:30 p.m. If you collected at 9, morning 9, then 9 a.m., 8 a.m., like that. Very important to write the date and time. And also sometimes you also need to mention the date of birth also. Date of birth of the patient, when the patient was born, just in case. Okay. And this urine collection, it is important for what? To diagnose the any kind of urinary tract infection. Okay, UTI. For diagnosing any urine tract infection, you should go for urine analysis. Okay, sometimes for also checking blood in the urine. If there is presence of blood in the urine, that also you can determine through the test. Okay, and thirdly, for diabetes patients also, it is very much required to go for urine testing. And also for kidney disease, all those people who have any kind of kidney disease, okay, acute renal disease or chronic or kidney stone, any kind of kidney diseases also, it is very much important to monitor the urine. Okay, and then through that they will be able to judge what the patient is suffering, and then treatment can be started accordingly. And also sometimes it is a part of routine medical examination, okay, to screen for early signs of disease. By chance you don't have any diabetes, nothing, you don't have any problem, but just for your own safety you are going to check. And if you have any signs, then you can cure your disease as soon as possible. You didn't have diabetes, maybe your family someone is having diabetes. Okay, so because of that, just because of the fear, you go to doctor for checking. Okay, and then you get to know that you are having symptoms, little bit, okay, little bit of symptoms you are having for diabetes. Then what you can do is you can take precaution as soon as possible so that you can be cured at an early stage. Okay, so these are some of the reasons that urine analysis should be done. Okay, all these things will be taught you in next semester. Okay, this semester, for this semester it is not so important, but just for your little bit of knowledge, I've just gave you the topic, and also I'm telling you, but next semester you will know it more better. After passing out this semester, in the next semester it will be more clear to you about this topic. Okay, so okay, Trishna, but Trishna, everything was okay, but the thing is that you should be clear about the topic. If your friends are asking something, you should not be like kya, not like that. You should know, acha, this one, okay, you just tell. At least you should write the meanings of whatever. I know that you all are not perfect still, but you should at least write the meaning of whatever you are explaining. Because anytime anyone can ask anything, to me blah blah kore to nohobo no, because you are the person who is presenting. So you should be very much like, you should know the topic very well so that you don't make mistakes. Okay, it's okay, next time you try it more better. Okay, and other than that, the group discussion was good, everyone was participating. Okay, tomorrow who have the seminar? Surajit. Yes, who have got the seminar tomorrow?
Me, ma'am.
Okay, okay then. Present it well, and also you have to be the master of the topic. Okay, you have to know everything, whatever you're explaining. And if your network is not good, you please try to manage it somehow. Otherwise, no one will be able to understand what you are speaking. Okman Sailoba network. Okay then. Thank you, and you please give your attendance to your respective CR. Thank you. You all can leave the class now.